Welcome to the What About Rural Health podcast, a place where research, policy, and real life stories come together to ask the critical question: what about the communities too often left behind? I am Chinasa, a development and global health policy strategist. And for me, this work is personal. From the village health workers struggling with limited supplies to the mothers walking miles for care, their stories shape the policies we need. Join me as we uncover challenges, spotlight innovations, and amplify the voices of those at the heart of rural health systems. Because every community matters, and it is time the world listens. Welcome back. You are listening to What About Rural Health with Chinasa Imo. So, Dr. John, I use asset base to establish a conversation, but to go draw us back to your work on Showroom City. And I'm going to
You insist.
I'm going to look at something that caught my eye in chapter 8 of Showroom City. Please, if you have not read Showroom City, is in Amazon. Go and buy it there and read this one fascinating book.
Or your local bookstore.
Or your local bookstore. Thank you for that. So, when I go to the last paragraph, almost the last paragraph, I'm not gonna start it, but Michael McDonald is a Grammy Award winner, right?
Yes.
Exactly.
I don't know where you're going with this.
Okay, I'm coming. I'm gonna get there. So, and I'm gonna read. The building surrounded the magic block provided ideal acoustic for the concert's powerful finale. Taking it to the streets. While MacDonald should not be construed as a protest songwriter, his song aptly captures the back and forth of social movement politics. Or you calling me the things you are gonna do, telling me the things you're gonna do for me, says the frustrated, untrusting activist in the lyrics. I ain't blind, he says to the adversary that has not gained his trust. And I don't think what I think I see. So I'm going to skip a little bit and then go to other places. The song echoes the strategies that a local High Point civil rights leader, the Reverend B. Elton Cox, employed over the years. In 1963, Cox has threatened to enact what he called his ace in the hole. You see where I'm going to? So, McDonald's rousing 2015 performance would have made a fitting commemoration of Cox's tenacious efforts a half century earlier. However, exposing High Point's rough edges during market was no more acceptable in 2015 than in 1963. So, having read this, and I am drawing parallel from 2015 and Cox's 1963, protest that you well documented in this chapter. I draw a powerful parallel across time, noting that while civil rights leaders often operated in the same physical space, using the same strategies sometimes, but, sometimes they could use different methods. And those methods could be significantly based on whatever is presenting before them. So, in your historical account of community resistance in High Point, North Carolina, you trace all of these resistance as how they evolved, in your book. Why do you think community resistance has shifted or can shift sometimes from streets to the boardroom?
Well, so I think one of the things that excerpt highlights is, and that is relevant across time and place is the front stage and the backstage. So, as I mentioned earlier, High Point has this global exposition that attracts 75 to 85,000 people from over 100 nations. And so Elton Cox said that I am going to have Black men lay down on the street at the central intersection of this global exposition, which wasn't that big at that time, if you don't meet with us. So I want to pause there for a minute, because I think this is very similar to nations that are organizing their cities for the World Cup or the Olympics or a regional athletic event that's causing them to bulldoze informal settlements or remove people who live on the street. It's this front stage, backstage thing. So B. Elton Cox was exploiting that and saying, we are going to bring your dirty laundry, your ills, your mistakes, your misdeeds into the front stage, but we won't if you hear our demands. So, I mean, I think that raises, and then so what happened was it moved into the conference rooms, and there were several concessions that came out of that, concessions that were similar around the country. One being human relations commissions, which would be a part of government that looked at complaints of discrimination. But I think the general issue is, number one, the importance of social movements. Like, social movements are very important. Social movement people don't like policy people, and policy people don't like social movement people.
Yeah.
That's fine, but they both absolutely need each other. Like, the nonviolent direct action requires this display of grievance, and it's very effective. But ultimately, at the end of the day, it's going to end in a conference room.
That's true.
It's going to end either in a church basement or a city hall conference room or somewhere else. It's gonna involve a table. And so I think it's really important that that we understand that process of moving from the street to the table, and that everyone at the table is not seen as a sellout, because when you have that, then you are giving up at the end of the process.
But at the end of the day, something
Yeah.
something must give. That's why it's called
That-
dialoguing.
Exactly. I mean, something was intended to change. The thing that's intended to change has to change in text, and that text has to be worked out in a conference room.
Exactly.
Right? So I think I think in High Point's case, I think looking back, you wonder, having had this global stage, could this global stage have been used and exploited more effectively by activists? And I think that's the case all over the world, where when you have the eyes of the world on a place, how can activists use those eyes for that time? Because the government is going to want to tidy up and sweep things under the rug during that time. And so that's always the tension. How can the community show what's really going on while the government tries to hide what's going on?
So when we look at this at the intersection of, this doing politics, right? And thinking about demanding for access to services like housing, transport, healthcare, etc. going on, and the power that within marginalized spaces, right? When we think about all of these things. And through that lens, what might we understand as a community trying to put up a resistance for, say, a government trying to coming back to the framework, a government trying to defund, say, a healthcare system towards the point that it becomes a closure because they are gentrifying, you know, projects that deprioritizes that. How would you look at that, from that lens?
So I think I would go back to this idea of short term community health and community well being. Let me not say health, but general community well being and long term community well being. So every social good cannot come about through profit.
That's true.
If it could, there would be no need for government. That's why government is not a business. But this doesn't mean that everything that isn't profitable and operating in the black today is a charity, because government, the whole point is to look at community well-being, and community well-being requires balance and wholeness in order to look at long-term community economic sustainability. As I said before, segregation costs money. Inequality costs money. It costs money in education. It costs money in jobs. It costs money in policing. Like, these things are not profitable. The only thing that's profiting is the private equity firm that's closing that hospital so that they can open another hospital. They're profiting. But the government's role is to balance all of this so that the entire community can
Yeah.
be more productive socially, politically, culturally, economically. And so, that's the whole point. And so I think the idea that a conservative would be for closing the hospital and a liberal would be against closing the hospital is just a very silly way of looking at the world, and shows how unholistic and how granular we are in the way that we look at well-being.
Thank you. That's true. You are still listening to What About Rural Health? We are collecting stories from rural environments where people experience either direct service challenges or have personal stories to tell about their experience assessing or receiving care in rural spaces. If you have such stories, please head to our website. You would see the link over there. Submit your story and we'll reach back to you on how to publish them on our podcast and in our website and social media platform. Welcome back. You are still with me here on the studio with Dr. John discussing what about rural health. So I'm gonna shift our focus a little bit to now talking solutions. And I know that in your upcoming book, it referenced a lot around urban slum. And I know that urban slums and informal settings are places where, when we talk about healthcare, is either urban health or rural health, but nobody looks at the peripheries that exist within urban spaces. And sometimes they even face far more challenges than the rural communities that we are concerned about, especially around healthcare access. So, applying these the value revalue frameworks around that and looking at the adaptation of urban planning strategies, that can be used to mitigate these challenges. The first question is, what would you advise an urban planner in addressing these challenges? And the second question would be, have you seen a model where both urban and rural planners look at these places as a bridge between the rural and urban spaces and work together to produce a plan that could address, urban and rural health issues.
Well, I think it's important to look at what the ideal is. I mean, and the ideal might not be possible, but I think the ideal in today's world is a regional approach. So, you need to look at we talk when we talk about informal settlements, you have number one problems of density and overcrowding, and disease transmission, and that can also be a place of strong social capital because you have that density, or it could also be a place of destabilization because there's so much overcrowding. And you talk about informal settlements, you're talking about places that don't have secure land tenure, where there's instability in the ability of people to stay rooted. So there's a residential instability, which leads to movement of people, inability sometimes to invest socially in a place. And you look at the trust in healthcare systems that oftentimes residents of informal settlements very justifiably lack because of things that they've experienced in the past. So that's what's occurring. Those are some of the social determinants that are determining health outcomes in informal settlements, besides the limitation of formal healthcare and the reliance on informal providers, right? So I think one common model in a regional approach is to consider a hub and spoke model, where you have a major hospital that serves as a hub for a region, but then you really build out the spokes of that wheel to reach out into more peripheral areas. And now the question is, how well are those spokes developed? Those spokes, or those tentacles that reach out into the peripheral areas, how do they reach out? One way that they can reach out is, and this is no news to urban planners. So this is more, for non-urban planners thinking about these issues, like community health workers would be the spokes that reach out to more peripheral areas and connect those peripheral areas to the health hub, which could be the major hospital. I mean, this goes back to kind of the basic lesson of all of the policies of the past, that those community health workers need to be local.
Yeah.
And they need to tap into the already existing leadership structures that exist in that community. So, you talk about B. Elton Cox. B. Elton Cox was a part of the U.S. Black Civil Rights Movement, which used the strongest institution within Black communities, which was the church. And once that church was mobilized, the whole structural skeleton of the movement nationally was able to take shape. So every community has an existing structure. And so I think community health workers need to be a part of the expertise of those local structures. And then, look, social determinants of health needs to be part of regional planning, so that you have regional health impact plans that consider, how does health apply to every policy? How do we put health into every policy? Because the social determinants of health are every policy: transportation policy, education policy, pollution mediation, et cetera. All of these other non-health policies are health policies. The problem here, again, is that it's very hard to politicize this, because all of these things brew and percolate slowly over time. You can't You can't show results 3 years later as a mayor or an elected official. You can't show results 3 years later of here's how we completely changed everything. You have to say, trust me. You know, we are, and I understand that. You know, that's why I'm saying this is the best outcome, but each place has to navigate this in their own locally based way for it to be effective.
Thank you very much. And thank you very much, Dr. John. And I will just summarize all that you have said. I hope that I heard all that you said. But if there is nothing that I did not hear, one thing that stood out to me is your mention of having community health workers being part of the policy structure from get-go because they're part of the stakeholders, right? And then the conversation about establishing the fact and the understanding that every communities have leadership structure. And, in making policies, if you ignore those structures, there would be problem. And I think that is why there's always this cutoff between what the people want and what policies are projected towards. And when that disconnection happens, the adaptation becomes difficult. And when it becomes difficult, the ability for implementers of that policies to show the result becomes even difficult because there's already a fallout between what the policymakers are thinking about and how the communities are seeing the way they want to accept solutions to their problem, including where do you cite our healthcare services? Who provides these services to us? How do we, accept and receive these services? It's always very important in terms of looking at, cultural acceptability and respect, and I think you mentioned that a lot. And then broadly looking at social determinants of health, that just providing medical service is not enough. We have to look at what constitutes the healthcare issues within a particular community and use that to build up. But most importantly, space matters. So we've discussed a lot here, and you have taken time to describe to us how these frameworks impact the way we see societies and all of these things. Is there, in your closing, is there like an advice that you give to advocates and people who do community organizing to improve healthcare accessibility? Is there something from your book that you can say, hey, or from your work or your experience that you can say, hey, if you look at this more closely, you can be able to work with different stakeholders to do proper planning and to build out a structure that promotes healthcare services within the community? Thank you, Dr. John, for coming to our show today. And for our listeners, I would invite you to stay with us, listen to the podcast, and if there's something that you learn out of it, please share to your audience as well and leave us a review. You are still listening to What About Rural Health? Because health isn't just about systems, it's about the people those systems are made to serve, how they make meaning of the places they call home, which sometimes are left behind. That is why we continue to ask this question, what about rural health? Let's create this together. Until next time, I'm still your host, Chinasa Imo. Thank you. Bye.